And this is a very vital book for all of us when we start our practice, or we are practicing since a few years, or if we have practice for years but still keep on referring this book. So there are few important things in this book, and before starting the remedies, I would like to read out few important lines from Allen's keynote's preface, which Allen himself had written when he published the first edition. So the very first line, what Allen says, and we all should remember, is that the life work of student of a homeopathic materia medica is a one of constant comparison and differentiation. So if you just observe these lines for few minutes, if you try to focus on these lines for few minutes, you will know that the homeopath has to constantly compare one remedy with the other. He has to differentiate one remedy from the other, and in this process he will be able to understand how he is getting closer to the simillimum which he needs in his practice. When you are a student, you study the materia medica in a different light. When you are a practitioner, you study the materia medica in a different light. So in the preface, he also writes further that apart from the minor symptoms which each remedy has, there is a commonality which is also known as the red strand of the remedy or the keynote of the remedy. For example, aggravation from motion for bryonia, or amelioration from motion for rust ox, or indifference of phosphoric acid, or the vicious delirium of belladonna, or the violence of belladonna. So this violence or this fury of belladonna has to be seen in the practice, in the clinical case as well. For example, the patient will refer with the rapidity of symptoms and the inflammation which has developed within a few hours of his exposure to certain environmental condition. So you need to know that this strand is running through the remedy and through the patient, and that is what we should aim for by reading the Allen's keynotes. So this book was written by him for his alumni in the Herring's college, and he continues to help all of us in our practice. So without wasting much time, let us go and see the first remedy. I would start with the first remedy, which is abrotanum, but we will slowly proceed to other remedies which are related to abrotanum and not just stick to the alphabetical order of arrangement. So the first thing what uh, Allen writes about abrotanum is that there is marasmus. So you see a patient who is a lean thin fellow who enters your clinic, and he does not have much muscle mass, and there is a lot of emaciation, and there is especially emaciation in the legs. So this marasmus, you can compare abrotanum with many other remedies at many different levels. Abrotanum has been compared by Allen with natramur, sanicula, iodum, tuberculinum, ethusa, and every remedy has different levels of marasmus. Some will have in the upper body, some will have in the lower body, some will have in the uh, entire body, some will have only in the neck. For example, ethusa will not be able to hold the neck at all. This is what he writes. So if you see a patient who is entering your clinic, who is a child who is very lean thin emaciated, and the uh, muscles are not well developed, poorly nourished child, think of abrotanum as one of the remedies, along with natramur, sanicula, tuberculinum, ethusa, and iodum. The next thing he writes is that there is great weakness and prostration, and the child is ill natured, cross, irritable, despondent, violent, inhuman, and would like to do something cruel. So you have these children who are in the age of 7 to 8, or between 5 to 10, who don't obey their parents, who are constantly told that you don't do this, don't do that, and they want to retaliate that no, I want to do this anyhow. So that is the nature of abrotenum. That is the state of abrotenum which you will see in your clinic. You will need to think of remedies like Merksol, although here he has not compared any remedy in this particular line where he says the child is ill-natured, irritable, cross-despondent, and would like to do something cruel. But Merksol very close in this type of mindset where the patient is defiant. He wants to retaliate. He wants to fight with the parents. That he wants to have his own way anyhow. So this abrotenum child will do something cruel. He will either hit the parent, he will throw something. Another aspect on the physical area which I have seen and I very vividly remember in the early days of practice, one child was brought by his parents, and the parent told that he has intense cramps in the calf region. And I was thinking that because the child is not having muscle mass and it is summer season, he is not drinking enough water, he may be having these cramps, and that can be one of the reasons. But after a few minutes of investigation, they told me that he also had pain in the abdomen 2 3 days back, and now he's having pain in the calves, but now the pain in abdomen is not there. So these cramps that follow the colic, there will be pain in abdomen or certain area of the abdomen, and then they will have pain or cramps in the extremities. These are indicative of abrotenum. I just gave abrotenum 1 m and 1 dose, and because I was not sure in the early days of practice how would I repeat. If I would have seen the patient today, I would have given him 1 m every 1 hourly. Of course, adequate hydration was required, which he started later on. But at that moment, we need to give something to help him. The chronology of the symptom is that always there will be pain in abdomen, and then there will be pain in the legs or cramps in the legs, and that is what we need to understand for abrotenum. There is no remedy which compares like this. Another remedy which I very well remember is the ranunculus. It also has a similar alternating symptom, chest pain alternating with colic. It does not have a follow pattern, it does not have a chronology. I had given to one of the teenagers who told that he had kind of a chest pain after the colic in the abdomen, and ranunculus bulbosus is very close remedy for such type of patients who have chest complaints alternating with colic. But if you have extremities complaints alternating with colic or after colic, think of abrotenum. Next is many times we think of rust dogs, bryonia, or some XYZ remedy, which is typical rheumatic remedy for rheumatic complaints. But one of the top remedies, which Dr. Sunirmal Sarkar has shown in many of his cases in the seminars that we organized for him and also the webinars, abrotenum was one of the remedies. And abrotenum, why and where it was indicated, where there was kind of a loose stool in the patient, and the patient was given kind of some antibiotics or steroids, and after that the rheumatism developed or increased or got worse. So you see this rheumatism and excessive pain before the swelling. So there is no swelling, but there is just this pain which is discomforting the patient. You can think of abrotenum as one of the remedies. Or it will have alternating complaint of joint pain. Once one day, after a few days there will be hemorrhoids, after a few days again joint pain, after a few days again hemorrhoids. Picking up alternating symptom from the patient is a very very artistic way which we should develop, which we should learn. Maybe in few days I will also hold a workshop on how you will pick up the alternating symptoms and concomitant symptoms. But as of now, let's stick to Ellen's keynotes. So there will be rheumatism alternating with GIT complaints or extremities, cramps in the extremities alternating with the GIT complaints. And there will be especially the joint complaints with marasmus or emaciation of the lower legs only. And there will be, this can be a very good remedy for rheumatoid arthritis, uric acid complaints, or rather you can say that it is more of uric acid rheumatoid diathesis than the uric acid diathesis, because in uric acid diathesis the metabolism changes entirely, whereas here it is more adapted to rheumatic diathesis. So in your cases, wherever you see rheumatoid arthritis patients, you should think of abrotenum as one of the top remedies. You can also compare this remedy with Rustox, Bryonia, and other remedies. One of the top remedies which you should think of in rheumatoid arthritis is Medorinum. So if you don't have any clear indications of any remedy coming in the case, or you're confused what to start with, give Medorinum, let the pain settle down, because it's a psychotic condition. You will see some changes, then you can think of the indicated medicine, or you can study over the medicine after a few days. So many people have joined in the Instagram live, and some are on YouTube live. We are doing simultaneous live. So I would like to share that we'll do this every day at 6 p.m. for 10 to 15 minutes, and give you a quick revision of the Allen's keynotes and all the remedies. Today we are covering the first remedy, which is abrotenum. And last but not the least, it is important to know the relationship of the various remedies explained by Ellen in the different areas where he has mentioned. For example, for marasmus and hunger related symptoms, he gives comparison of abrotenum with natramur, iodum, sanicula, tuberculinum, and ethusa. Sanicula is a very intriguing remedy. I will share that it is a combination of calcarea carb, natramur, Cilicia, tuberculinum, etc., etc., etc. So we'll cover that maybe tomorrow and much more in detail. And abrotenum is also compared with opium and agaricus in complaints of face and skin. So there is an old looking face, there is a shriveled face, which will make you think of opium, agaricus, or abrotenum. Also natramur can be thought of, also lycopodium can be thought of. And last but not the least, in the relationship section specifically, Ellen mentions that there is a comparison done with Hepar, or after Aconite or Bryonia in pleurisy. For Hepar, he compares it in skin complaints. And this is all about abrotenum. So you can join tomorrow again at 6 p.m. with your Allen's keynotes, and we'll do a study of sanicular remedy, and we'll do this as a study streak to cover maximum remedies in a daily pattern. If it changes, my schedule changes on certain days, it will be done early in the morning, maybe 6 o'clock or 8 o'clock, but we'll continue this till we finish all the remedies from Allen's keynotes. So those who have joined, I hope it was a good learning, and you can watch the recordings again later on. It will be put up for a few hours, and we'll remove it because we need to keep on putting more useful content. This all is just to help all the homeopaths. So let's meet tomorrow again 6 p.m. Meanwhile, if anyone from the audience has any question, please feel free to type in the chat box, or add a comment in the Instagram or YouTube, so we can see if there are any questions or any comments or any query by anyone related to the remedy or Allen's keynotes or something we discussed today. If there is something else, I would definitely take it up in another live session, maybe sometime later. And see you all soon.